everything might not be fun.
The politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing. I'm just getting totally unhinged now, and I don't know what to do. So, when we were talking about all these extra tests, all these stress tests, and extra drugs, and stents, and drugs for dementia that don't work, we'll be going on and on and on and on and on about things that doctors do that don't work, and that we pretend do work to make you happy and to sometimes, for some people, make a little extra money. Because the money in medicine is frankly in two things. One, you're a specialist, and two, if you do a lot of procedures. Like we've said, if you put in a stent as a doctor, you're going to earn as much money as I, as a primary care, make during an entire day of seeing patients. One stent. But even more so, a lot of these doctors who are specialists who do these procedures and tests own their own equipment. Gastroenterologists, you might go there for a colonoscopy, which itself isn't that much money, but the fact that they own the suite and own the equipment, it becomes a relative fortune that they're taking in for every little scissor they use. Cardiologists own their stress test machines. A lot of surgeons own outpatient centers or have interest in there. So the money is flying in the more they do these tests. And so they're going to want to do tests. Our system is set up for this. My dad, who is a lover of doctors, doesn't ever question what they do or what they say, just totally believes that their integrity is from the heart, that they want to help people. In fact, that's one of the reasons I'm a doctor, is because he so persuaded me to do that. He called me up today and pointed out a study that he found in the newspaper that showed, and I'll cite the study, that showed that cardiac stents, even done in people in pain. And remember, we were talking about how stents don't work to help people live longer if you don't have symptoms. But here are people who have symptoms. They have pain. And these guys have pain and blockages. And the thought is, if you open up the blockage, you're going to relieve the pain. Pretty simple conclusion. But what they did is they took half the people and they put in a stent, and they did the other half of the people and they just did pretend stent. They did the whole procedure, but they didn't actually put in a stent. And they put both groups on the same medicines you'd go on after a stent. And months later, they asked them how they were feeling. And both groups had a substantial amount of people who felt better. Even the people with the placebo, the power of the placebo. We're going to spend a whole section talking about how powerful placebo is. But the stent was useless. It was no better than placebo. Placebo is way cheaper, just want to let you know. But this is what drives doctors, is this illusion that they will actually help people. Maybe they believe it, maybe not. Some of them should have the same evidence. My dad said to me, how come these cardiologists don't know this when you, Andy, have been saying this for the last 10 years? And I said, I got it from books that are 10 years old. I mean, this knowledge is out there. It's not some mystery. So why specialists who go through all this training to study a tiny little organ don't know this information is beyond me. We know this doesn't work. We know about cholesterol. We know about stress tests. We know about EKGs. We know about stents in the cardiology world. We know about dementia drugs in the neurology world. We know about all sorts of things that we'll be talking about that don't work, that are being pushed by specialists all the time. And I don't know the answer. Specialization, in my humble opinion, is the problem. Since we have gone to a society, we've become a society of specialists, the costs have escalated, the outcomes have declined. That's been well studied. We know that in areas of the country with more primary care doctors, cost is lower, outcome is better, satisfaction is higher. But there are fewer and fewer areas of the country like this. Most healthy medical societies would have a vast majority of their doctors being in primary care. In our medical society, 20% of doctors are in primary care, and that number is shrinking because no one will go into the field, because the pay is much lower than specialty care, and frankly, it's much more difficult. We're having to just see volumes of patients to keep up. We're having to constantly be audited by Medicare. I'm in the middle of an audit right now, which is horrible. It takes up huge amounts of time. And we're constantly also having to escalate our overhead to keep up with quality indicators and other regulations that they're dumping on our back. So people don't want to go into primary care. People in medical school who accumulate all this debt, $200,000-$300,000, know that they're going to make a lot more money if they go into specialty care, and that's where people are going. So primary care is becoming extinct. The people going into it now are from other countries. A lot of nurse practitioners are filling some gaps, which is fine. Nurse practitioners I work with are the best people that I can work with. They're wonderful. But doctors aren't going into this field. So specialty care is accelerating. And the more cardiologists we have who want to make this money, who want to do these things, the more stents, stress tests, cholesterol medicine are going to flood society. The more you as a patient are going to hear that these are what you need to save your life. There's a committee on the AMA, the American Medical Association, called the RUC Committee. It's a secretive group of doctors who sit around a table. I just imagine like sitting around the table, you know, dealing cards, looking at things. It's made up almost exclusively of specialists. And they determine how much you're going to get paid for what you do. They then give their little recommendations to Medicare, who then sets a fee schedule. And that fee schedule is borrowed by just about every other insurance company on the planet. I should say in the United States. But that fee schedule favors procedures. So the more procedures you do, the more money you're going to make. The more you think and try to talk people out of getting a procedure, the less money you're going to make. So if I sit around and talk to someone about smoking and how they should quit and how they should lose weight, and maybe they don't need the stent, and here's why they don't need the stent, I will get 1/20th the amount of money that the guy in his scrub suit gets for putting in the stent. And yet maybe what I've just done in my half hour is a lot more valuable to my patient and to the medical society than the guy putting in the stent. So you got to wonder why insurance companies such as Medicare and every other insurance company are willing to pay that kind of money for low value care. That's the crux of the problem. I've talked to a ton of people in insurance companies and they don't want to pay that money. They get it. But there's a lot of pressure on them to do it. The pressure comes from groups that represent these doctors, from congressmen who help Medicare determine what they're being paid, because they're also influenced by these people. And it comes from consumer groups that feel like any interference between the doctor and the patient is akin to catastrophe. But, you know, interference between the doctor and the patient, telling an insurance company, say, we're going to pay you $200 to put in a stent because we think that's what it's worth, that's not interference. That's just reality. And I don't know why they don't do that. I think because they're going to get such a negative reaction by everyone, because these specialty groups are powerful. They get it. They know how to manipulate everybody's thinking. They will publish op-eds. They will talk to congressmen. They will put a full-page ad in a newspaper. They got the money. They got the power. So specialty care is our problem. If we start becoming a society that is more focused on primary care, we start paying primary care doctors commensurate with what specialists make, and have more and more doctors go into it. But mostly, if we educate patients as to what to talk to doctors about, and to be skeptical about this message that they're getting from newspapers, drug ads, and from specialist doctors, to be skeptical of it, maybe we could change the system. But until we get away from our specialty-oriented system, we don't have a chance. So I'm going to talk to Mike and Paul about it a little, because it is tough. It's a tough issue, because nobody really understands that our medical society is all messed up this way. And a lot of people think just doctors are all good, and they are. I'm not bad-mouthing them, but their motives are suspect. And frankly, regardless of their motives, doctors should not be paid lots of money to do low-value procedures, or to give out drugs that don't work. Because if they get paid all that money to do it, they're going to do it. It's just human nature. We're not saints, you know? I hate to say it. But anyway, we're going to talk a little about how we could save primary care. That's a huge part of my book, and it's a huge part of what we have to talk about. And patients have to be completely involved in this if it's ever going to happen. We have to fight for a primary care system where you can go to your doctor, your primary care doctor, spend a half hour or so with the doctor, be able to get good information about what tests and procedures and drugs are good for you, and be able to make your own decisions. And then if a specialist is needed, we'll go to a specialist. So I talked too long. It's a beautiful day, and I'm going to go finish my run. Take care. Hey, so if you're equally annoyed by our dysfunctional healthcare system and all the garbage you're being fed, then give me an email, log on to my website, which is listed down here. Let me know what you want me to talk about, and I'll just keep feeding you information, and we'll discuss this and hopefully make some changes. See you later.